Hello, good morning. You're welcome to A&D Referral Services YouTube channel. My name is Itinolu Fadi. I am a developmental psychologist as well as a case manager, substance use case manager at A&D Referral Services. Thank you for joining us in today's edition of what are the commonly used substances in Nigeria, what are the effects and the long-term effect and short-term effect of substances in Nigeria. So let me briefly explain to you what we do at A&D Referral Services. A&D Referral Services is a faith-based organization where we do case management of alcohol and drug addiction, and we help people that are struggling with alcohol addictions to come for faith and to stay free for life. And so we have been in existence for the past 3 years now, and we have had a lot of cases. We have handled a lot of cases. We have managed a lot of cases, alcohol cases, alcohol addiction cases, cannabis addiction cases, cocaine, and all the other substances. And this initiative going live on YouTube channel is just to, psychoeducate people about the substance abuse, about addictions, and how people can find help for their loved ones. Today, we are going to be talking about cannabis and what are the short-term and long-term effects of cannabis. Sorry about that. What are the short-term and long-term effects of cannabis? So let me know in the comment section if you can hear me. Let me know if you can see me and hear me clearly. Okay, so let's write. What is cannabis? Cannabis is derived from a plant called cannabis sativa. This is the most commonly used drug in Nigeria, even at the world at large. So cannabis is the most widely used substance in the world at large and in Nigeria as well. Cannabis is a depressant substance. Yes. Is a depressant substance. That means it slows down the rate of it slows down the central nervous system, and then it also slows down the rate of communication between the brain and taken in large quantity. When cannabis is taken in large quantity, it can cause an hallucinogenic effect. That means it can cause the user to hallucinate. An hallucinogenic effect is when someone is experiencing a distortion in seeing, in vision, and in hearing. When there is distortion, probably maybe the person is seeing what is not real, or is seeing a distorted image, or is hearing what is not real. Now, the main active chemical in cannabis is called THC. It's called THC. So this is the chemical that is responsible for the highness in the individual. Cannabis is seen in three main forms. We have marijuana, hashish, and we have what we call hash oil. And just like I have said, cannabis is one of the most, it's not even one of the most, it's the most widely used substance in the world at large. Why are we putting up this? We understand that from our experience working with clients that a lot of family members, loved ones, are probably not aware of some of these commonly used substances, or probably they are aware but they don't have an accurate knowledge about the specific substances that their loved ones are struggling with. So we put up this initiative to educate people about the different substances we have and how loved ones, families can help their loved ones to get help, to get treatment for their addictions. Okay, so we'll be asking some questions, answering some questions in relating to cannabis and what people can do. The first question we are going to answer: what are some of these common names? Because yes, we know it is called cannabis, that's the scientific name, cannabis. but there are a lot of street names that people, youths, young adolescents call cannabis. So these street names actually vary from one locality to another. It varies from one community to another, and it varies from one country to another. But what has will be examining the commonly used street names in Nigeria. So we have what we call Wiwi, Igbo. Cannabis is widely called Igbo in Nigeria. Igbo. So when you mention Igbo, you know that they are referring to cannabis. Igbo, Wiwi, Ganja, skunk. They also call it blaze, taba, Inde deco, and Bende markets. Indian hem. Yeah, people call it Indian hem, scoosh, yo-yo, a lot of things. They call it marijuana, Mary and John, choco, ganja, green leaf, a lot of things. Arizona, loud, and the synthetic one that is usually widely known as Cal Colorado. So these are some of the street names. And let's bear it in mind that they innovate new names every day, almost every time. Why? Because sometimes people that are using it just want to leave it coded for those that are not aware of what they are using. So sometimes you may need to actually stay more aware of what is going on in your environment, just to be informed about other new names that cannabis or other drugs are being called, and we find out that it is what is commonly known as cannabis. So these are some of the street names that we call cannabis. All right, so what are the short and long term effects of cannabis? The short term refers to the short time it can last for 2 hours. That's the short time, the effects that cannabis has after the use. What are the short term effects after use? So this can last for like 2 to 3 hours, 2 to 4 hours in the body. So what are the effects of cannabis in the body? So we are going to review short term effects of cannabis. The first one is loss of inhibition. Of inhibition means that the person can feel unusually well, happy, and talkative. Talkative. So the person will just feel happy unnecessarily. We call it euphoria in psychology. So the person will just have a feeling of euphoria, feel happy, excited, and just talk their out. So they just talk anyhow, they just talk anything, without any cause to that. So this is what we call loss of inhibition. The other one is spontaneous laughter. The person just laughs spontaneously without any cause to the laughter. That's the effect of cannabis use. The third one is quiet and reflective mood. We've had in our experience with interacting with clients that they believe cannabis give them this effect for this inspiring effect. That means sometimes most of them that are into music, they'll tell you that they get inspired after cannabis use. So these are some of the short-term effects of cannabis. So some people will tell you that they use it for inspiration. So what they are trying to refer to is that cannabis actually puts them in a quiet and in a reflective mood. Sometimes people will tell you that they are in another world when they use cannabis. The other the other short-term effect of cannabis is anxiety, altered memory, thinking, and confusion. Cannabis use alter memory. It alter memory. It alters concentration. It alters thinking. They don't think the normal way. They are confused sometimes. And cannabis also alter vision. It alters vision, and sometimes it comes with bloodshot eyes. That means their reddish look appears reddish in color. So bloodshot eyes, realization of sleepiness. Another thing is that it decreases the nausea. Like sometimes people feel the feeling of sickness. They have a feeling of sickness in the stomach. Another thing is that, which is one of the most one of the reason why people use cannabis for increased appetite. So sometimes when we interact with our clients, they tell you that they use cannabis to increase their appetite. So now we move to the long-term effects of cannabis. What are the long-term effects after continuous and regular use? of cannabis. So what are the long-term effects? Now, the long-term effect actually cannabis long-term use of cannabis actually have effect on four major organs of the body or major parts of the body: the brain, the immune system, the hormone system, lungs, and and mental health. So the first one, brain. Some research has shown that there is association of impaired concentration, memory, and learning ability. So sometimes people lose concentration after a long period of time that they've been using cannabis. They lose concentration, sometimes they lose memory, and learning ability is impaired. Learning ability is impaired. The second long-term effect is lungs. Sometimes people complain of sore throat, asthma, and the bronchitis. So these are some of the effects of cannabis. The other one is that cannabis can lower sex drive. So we call it low libido. So sometimes long-term use of cannabis can affect the sex drive both for men and for women. Irregular menstrual cycle and lowered sperm counts. These are some of the effects of cannabis. Another thing is the immune system. People are more likely to develop cough, colds, and other illnesses associated with an impaired immune system. That means their immune system begin to deteriorate over time. Mental health, sometimes heavy and regular use may result in a drug-induced psychosis. We have what we call drug-induced psychosis, which can be gotten from long-term effect and long-term use of cannabis. Psychosis symptoms include delusions, hallucinations, hearing, auditory hallucination, and visual hallucination. You know, seeing and hearing things that do not exist. So these are some of the symptoms of psychosis and disorganized thinking or speech. Now, a big question that we would want to ask is: does cannabis cause mental health illness? Mental health illnesses associated with cannabis include depression, anxiety, and psychotic disorders such as schizophrenia. Schizophrenia is a mental disorder involving a breakdown in the relation between thoughts, emotion, and behavior. So, mental illnesses that are associated with cannabis use could be anxiety, depression, and drug-induced psychosis, including schizophrenia. Now, symptoms of cannabis psychosis is probably seeing and hearing things that do not exist or that are distorted. This can last for several hours or even days. However, most mental illness actually go away after the person using the cannabis stop using it. So after cannabis use is stopped. Scientific evidence supports an association between cannabis and schizophrenia. So there is an association between cannabis and schizophrenia. However, they've not been able to establish a cause and effect. They don't know which one actually caused the other. That means cannabis, there have not been an established fact that cannabis actually caused schizophrenia. However, if a person using cannabis probably has a family history of mental illness, that means cannabis can trigger schizophrenia, can, can trigger drug-induced psychosis. So then we move to the next question. Can you become dependent on cannabis? Can you become dependent on cannabis? Well, cannabis is associated with a lower risk of dependence compared to other illegal drugs, such as cocaine and heroin, or regular drugs such as nicotine and alcohol. Research has shown as many people who use cannabis across their lifetime do not progress to cannabis dependence. However, some people do become dependent on cannabis and go on to use it regularly or develop problems with it. Of course, research has not shown that people can get dependent on cannabis. However, some people do. We have had clients that have had cannabis dependence and have been addicted to cannabis, and that they have even actually developed negative outcomes from cannabis use. And so, what is dependence? Dependence can be divided into two types. We have what we call psychological dependence, and we have what we call physical dependence. Psychological dependence is when people feel an urge to use it when they are when they are in a specific environment. So they have cravings. When people begin to develop cravings for substance, so for when people begin to develop cravings for cannabis in this case, so that's called psychological dependence. That means they cannot, out of their own volition, say they want to stop. So they are already craving for it when they are in specific environment that triggers the craving, such as probably maybe they are clubbing, during night parties or environment. Some people, the craving actually, the psychological dependence has actually grown worse that mere seeing the advert or probably seeing people that smoke, such can actually trigger craving in them, such that they want to also smoke as well. That is what we call psychological dependence. While physical dependence is when the body builds tolerance for cannabis use, such that the person using cannabis has to increase their intake to still get the same effect that they do get from cannabis. So that is what we call physical dependence. Physical dependence occurs when a person's body adapt or build tolerance to cannabis and get used to functioning with the cannabis present in their body. So they are used to cannabis present in their body, so they can't do without it. So that's what we call psychological dependence. So what happens when mixing cannabis with other drugs? What happens? Mixing cannabis with other drugs such as alcohol or prescription drugs can produce unpredictable results. You cannot predict the results you get from mixing. A lot of people now, a lot of adults, young adults, adolescents, are now lacing cannabis with some other substances, and you cannot predict the effect. You cannot predict, of course, definitely the effect will be heightened because, and this effect actually varies from one person to another. There are many factors that account for the effect of cannabis in a person's body, depending, and it varies from person to person. So two persons can use the same degree of cannabis, but the effects they derive from it are different from each other. And this effect actually depends on many things, including the person's size, including the person's weight and health. Whether they are accustomed to taking the drug, sometimes the effect an experimental user will get will be different from someone that has been using the substance regularly. Another thing is their mood. The effect you get from cannabis will also depend on your mood. Whether other drugs are present in your body system. Also, if someone has been using other drugs that are still present in the body system, the effect will be different. They will get a total different effect. And the strength of cannabis and the amounts taken. These are all factors that contribute to the short and long term effect of cannabis. And also, there is a difference between the route of administration. Sometimes people smoke cannabis, sometimes people eat cannabis, sometimes they brew it with tea. So they get different effects. It is actually established, it has been established that the body system absorb cannabis in the system more quicker if it is being smoked than when eating. So when cannabis is smoked, it enters into the bloodstream quicker than when it is eaten or taken in tea or in other liquids. In other liquids. What happens when a pregnant woman takes cannabis? It is better to not use drug at all during pregnancy. Using cannabis when pregnant will harm the baby and increase the chances of premature death or smaller birth weight. Using cannabis when breastfeeding also can affect the baby because the baby can take in the cannabis. So research shows that among regular cannabis users, it may affect the fertility and the hormones connected to reproduction among both women and men. Among both women and men. So, what will you experience during cannabis withdrawal? A person dependent on cannabis will likely experience withdrawal symptoms when they want to stop use. Withdrawal symptoms commonly start on the first day of stopping, and usually peak within the first 2 or 3 days of quitting. People may experience withdrawal symptoms for less than a week, although sleep disturbance may be affected for a longer period of time. Withdrawal symptoms include sleep difficulties, including insomnia and strange dreams. Some people may experience nightmares when they are withdrawing from cannabis use. Another thing is mood swings, as we have established earlier, that cannabis affect your mood as well. So when someone is trying to withdraw from cannabis use, also they may experience mood swings or irritability. Some people may experience depression. Some people may experience anxiety and nervousness. Some people restlessness. They are just restlessness. They are just restless. Some people may have what we call physical tension, unnecessary uptight in the body. They may get anxious. Reduced appetite. We have established that one of the short-term effects of cannabis is that it increased appetite. Some people use it to increase their appetite. So when withdrawing from it, the appetite may decrease. Cravings. Strong desire to smoke cannabis is usually one of the withdrawal symptoms for cannabis use. So we put up this video so that people can understand, can learn more about this substance and what can they do. So what can you do if you have someone struggling with cannabis dependence or addiction? What can you do when you have a loved one struggling with this? So looking at all these short-term effects, you can tell whether your loved one is into substance cannabis use or not. Now, one thing you can do is to advise the person. You can call the person one-on-one and explain to them about the short-term effects and the long-term effects of this cannabis. A lot of people that are into substance use go through a denial stage, a stage whereby they deny the effects they are experiencing from substance use. So you can call this person one-on-one to explain some of these substance use, most especially when they are calm, when they are in their calm state, to understand what you are saying. However, if you are still struggling with it, you can call on us because we are into case management of alcohol and drug addiction. You can call us via our contact in the bio. You can call us and you can explain what you are going through with your loved one, and then we are here to support you, to guide you on the process and the procedures to help your loved one come off cannabis use. Thank you so much for watching us. If you have questions, if you have contributions, or if you have comments to make in respect of this video, you can just send your comments to us via our social media channels, via our social media platforms, and we'll be ready to answer these questions. If you want us to manage any addiction that you are struggling with, or maybe your loved one is struggling with, then you can call on us, book an appointment with us, book a session with us, and they will be ready to support you. Our value and our mission is to see people, to help people, and to provide rehabilitation services to those that are struggling with alcohol and drug addiction. So A and D is here to help you and to support you all the way. So we would like you to like this video, subscribe to our channel, and then also follow up on our subsequent videos. Thank you so much for watching us, and bye for now.